We are here at the Rise in Maylands for the launch of WA's first Multicultural Health Expo.
My role here today is to represent the Mayor of the City of Bayswater, who couldn't be here, and to open the event. It's a difficult thing coming to a new country. New customs, new culture, it's huge. And if they can come to these sorts of events, I think it helps them.
We particularly value opportunities to be involved with events like this, where the people who are supported by these organisations are going to be here at this Health Fest today don't necessarily have the same access to health services as a lot of other people in the population do. And one of our priority populations is new immigrants and people from culturally and linguistically diverse populations in the community.
There are multiple challenges about settling into a new environment. Almost everything changes for people when they come to a new country. Nutrition and physical activity are core, but the ways you do that in a different country, basically the food choices, all of that changes. So it's a large adaptive challenge. The basic philosophy is to work with groups who are working with migrants and refugee groups. And so you want people who actually understand the cultures from which people come and the particular societies, and who are working with them on a day-to-day basis. Because it's in the nature of our day-to-day choices that health is either promoted or not. And so we don't tend to work very directly with people, but we fund groups such as the Multicultural Service Centres to work with migrant and refugee groups.
The Multicultural Services Centre of Western Australia is an organisation that provides a range of services for migrants and refugees from diverse backgrounds, and it's been around for more than 3 decades now. The issue for everybody to understand is this: the mainstream population gets their services in a language that they understand, which is English, so they don't realise that all that we're trying to do today and every day that our centre operates is to provide exactly the same service, but in a language and from a cultural perspective that our clients are comfortable with and understand. When a migrant comes to Australia, he or she has got to pass one of the strictest medical entry tests. So at the time of their arrival, the average migrant's health is much better than your Australian-born person. But very quickly, their food habits change. They don't seem to exercise as often as they do. Many of them who are used to walking or catching public transport now drive cars. And in the case of mental health, they've got to adjust to a totally new system, leaving behind an incredible social support network which they had in the countries where they came from. If you look at some of the reasons why we do what we do today, mental health, major issue. You look at the Suicide Prevention Strategy Report, which anyone can access from the Mental Health Commission's website, you will see that migrants commit suicide at a higher rate than the Australian-born. Now, you look at the migrant population, you will see that what you call the non-English speaking migrants are committing suicide at a higher rate than the English speaking counterparts. But the worst of it all is the fact that older non-English speaking migrants have got a higher prevalence rate in committing suicide than the general population. That is something which I believe is totally unconscionable, and clearly we as a society have to do much more to ensure that the social isolation that many of them currently experience are addressed, and more importantly that they are actually provided multicultural mental health services which, as I said, are both culturally and linguistically appropriate to their needs. It is important that both governments and communities work together. What you saw today is a partnership between government agencies, a whole range of mainstream and multicultural service providers coming together and making use of the strategies that an organisation like us has put in place to disseminate health and well-being messages and activities that people can follow to promote their health and well-being.
This has been Miles Riley reporting for Undercurrent.